Hi, let's learn about Osgood Schlatter disease with me. This disease affects the tibial tuberosity and the patellar tendon. It's an irritation below the knee joint. It's commonly found in young athletes in sports that require jumping or running. People with this disease will have a painful bump and swelling below knee joint. This disease commonly affects active children and teenagers, from range 10 to 15 years old who play sports or overusing their knee. Why the disease commonly affect young people? It is because their tissues are still growing, especially their bones. Below their kneecap will have a bony bump. It can be soft or a hard structure, depends on stage. It has earlier stage which should be soft because of inflammation. And later stage will be hard because of bone formation. So as you can see, the patellar tendon was inflamed. The tibial tuberosity has microfracture, inflammation, and will had an abnormal bone growth. It is because of the irritation of the bone growth plate at the tibial tuberosity. Repetitive strain injury or overuse. They do lots of intense physical activity. It will cause the irritation or inflammation of the patellar tendon spread to the growth plate of the tibial tuberosity. Lastly, it because they always do an activity that can stress the knee like squatting. Before that, let me explain to you about the bone growth plate and the causes of tension in the patellar tendon. The bone growth plate is an area that helps bone to grow longer and develop in a correct size and shape. It is made of cartilage which is not strong, and high levels of stress will hurt and swell it. It will harden when the person stop growing up. The causes of tension of the patellar tendon are when quadriceps muscles become tight because of not relax properly after lengthen during repetitive knee flexion. This cause tension and stress to the patellar tendon. The stress irritates the patellar tendon and become inflamed. The tibial tuberosity attaches with the tendon will had microfracture and inflamed. The first sign and symptoms is having knee pain, especially when doing sports-related activities like running and jumping. Second, they will be feeling like tenderness at tibial tuberosity, especially when touch. Third, there will be a swelling at the tibial tuberosity. Fourth, they will having tight muscles at the back and front of the thigh. Lastly, there will be a bump below the kneecap. Doctors will assess the patient's history by asking for symptoms. Then they will apply pressure to the tibial tuberosity. The patient should feel pain or tenderness. Then they do physical examination by ask to do movements of the knee like running, jumping, or kneeling to see if the movements bring painful symptoms. Doctors also will do X-ray if needed. It is to confirm the cause of the pain is fracture. For medical management, doctor will help to manage the pain by prescribing nonsteroidal anti-inflammatory drugs like ibuprofen or naproxen to reduce pain. Doctors will also advise them to rest and modify their activity by limiting sports activities that require jumping, running, or deep knee bending. Physiotherapist will ease the symptoms first. When the pain is under control, they will proceed with focusing with the patient's flexibility, balance, and strength of the leg muscles. Pain management is to reduce inflammation and pain. Physiotherapist will do some therapy for the patient like ice therapy, heat therapy, ultrasound, and electrical stimulation like transcutaneous electrical nerve stimulation. Other than that, physiotherapist also will recommend the patient to wear patellar tendon strap. It should be worn between the bottom of the kneecap and the bump. Physiotherapist will give the patient stretching and strengthening exercise after the pain was under control. For stretching exercise, the targets are quadriceps and the hamstring. This exercise will help reduce pain, relieve tension and maintain flexibility. For strengthening exercise, the target muscles are quadriceps, hamstring and hip muscles to improve overall leg mechanics. In addition, the bump that hardens as possibly can be removed by surgical. But most people live with it because surgery will not be recommended by the doctor unless the patient experiences severe pain. That's all from me. Thank you for listening.